Hello Dr. and friends, we are from SGD B6 and we will present you our student project with the topic Addison's disease. My name is Shanti Dewi with my student number 142. So Addison's disease is a condition of primary adrenal insufficiency that is acquired or happens because of autoimmune. The autoimmune attacks could cause the destruction of bilateral adrenal cortex, and then after that, it won't function as the same as before, causing the production decrease of adrenocortical hormones, for example, the cortisol, androgens, and also aldosterone. Addison's disease is a rare condition with no specific symptoms for the earlier stages, and it made it so difficult to diagnose early. So these symptoms can be found in other diseases too, like the normal fatigue, vomiting, weight loss, etc. So as it is rare, most medical personnel are inexperienced too against this disease. So many are diagnosed only after life-threatening conditions. Therefore, it is necessary to develop a deeper understanding of Addison's disease, which exactly is the aim of this student project. So here are the formulations of the problems, and then the purposes, and here are the benefits of this student project. Thank you.
My name is Tiara with student number 105. Addison's disease is a rare autoimmune disease by an acquired primary adrenal insufficiency. This disease is rare. However, despite from being rare, it could be a life-threatening condition if not treated. This disease is often diagnosed late after adrenal crisis and is accompanied by glucocorticoid and mineralocorticoid deficiency. This disease happens as a result of bilateral adrenal cortex destruction, causing adrenocortical hormone to decrease. Thank you.
Good afternoon, doctors and friends. My name is Jennifer Luisa, student number 018. Addison's disease is a rare condition with estimated number of people affected being 40 to 140 per million and around 5 to 6 incidences per million each year. The global variation of this disease may be influenced by several factors such as genetics, environment, adequate diagnostic means, and the lack of nationwide patient data which is of good quality. The common age of presentation in adults ranges from 30 to 50 years of age, with higher incidence occurring in women, which constitutes to around 60% of cases. In children, there is not much data on the incidence of etiologies other than congenital adrenal hyperplasia, which is the main cause of Addison's disease in pediatric patients with around 100 incidences per million, representing 62% of cases. This number is followed by autoimmunity, which causes 24% of cases, and the remaining 14% being divided between several different genetic diseases.
My name is Jennifer Jasmine Gunawan, student number 068. The etiology of Addison's disease is the adrenal cortex's inability to produce adequate adrenocortical hormones, and is divided into primary and secondary adrenal insufficiency. Primary adrenal insufficiency is caused by diseases that lead to direct adrenal cortex injury. The leading cause is autoimmune destruction of the adrenal glands. Other causes include infections such as sepsis, adrenal hemorrhage caused by the IC or trauma, infiltrations which occurs in hemochromatosis, amyloidosis, and metastasis, certain drugs such as ketoconazole, as well as malignancy and several genetic disorders. Secondary adrenal insufficiency is caused by exogenous steroid administration, which leads to suppression of ACTH synthesis. Risk factors of AD include other autoimmune disease, such as type 1 diabetes, hypoparathyroidism, hypopituitarism, pernicious anemia, Graves' disease, etc.
Hello everyone, my name is Diah Sutari, student number 173. The first discovery of ACA was in 1962 through immunofluorescence and followed by the discovery of enzyme 21-hydroxylase as autoantigen in 1992. Findings of these antibodies may predict potential adrenal failure. Lymphocytes infiltration can also be found in Addison's disease and is a typical feature of autoimmune diseases in other organs. Impaired suppressive function of CD4, CD25 regulatory T cells is also reported to occur in patients with AD, where CTLA4 plays an important role as a downregulator of the T cell response. Tuberculosis and HIV are often seen combined in patients, and also environmental factors are said to influence the developmental of this disease. However, autoimmune initiation factors are still unknown.
Hello Dr. and friends, my name is Duna Ulisi Dauru, student number 165. I will explain about the clinical manifestation of Addison disease or AD. Most clinical manifestation of AD are non-specific, especially in the early stage. AD is usually associated with acutely or chronically ill patient who experience weakness and fatigue, weight loss with decreased appetite, weight loss with failure to thrive in children, sometimes resembling with anorexia, orthostatic hypotension and tachycardia, skin and mucosal hyperpigmentation, nausea, vomiting, and diarrhea, or recurrent abdominal pain, which may even present as surgical emergency, amenorrhea or libido reduction, depression, and salt craving or hyponatremia. AD frequently presents with seizure following with hypoglycemic crisis in children. Deficiency of glucocorticoids and mineralocorticoids are characterized by hyponatremia, hyperkalemia, and hypoglycemia. Dehydroepiandrosterone deficiency in AD patients may result in severe androgen deficiency, especially in women with AD presenting as loss of pubic and axillary hair or reduced libido. Thank you.
Hello, Dr. and friends. My name is Naluputu Sarwat Shawidavtri, number 224, and I will explain the supporting examination for Addison's disease. Before I explain, there are a lot of diagnostic tests for Addison's disease, but I will only explain 5, which is rapid ACTH stimulation test, ACTH plasma test, blood chemistry test, plasma renin activity test, and radiologic test. Now, the first is rapid ACTH stimulation test, where ACTH is adrenocorticotropic hormone. Cortisol and aldosterone will not respond to ACTH in patients with Addison's disease. Now, the second one is ACTH plasma test. In patients with Addison's disease, the ACTH level is usually past 250. As in pituitary dysfunction causing secondary adrenal insufficiency, the plasma ACTH is normal or low. Then blood chemistry test. For blood chemistry test done to Addison's disease patient generally shows hypoandremia, hyperalkemia, and mild metabolic acidosis. And then plasma renin activity tests, well, it is where plasma renin activity is increased in Addison's disease patient and usually found in further stage of the disease. And the last is radiologic test, which includes CT scan of chest and X-ray chest, can help determine the cause of Addison's disease but not determine diagnosis. Thank you.
Hello, Dr. and friends. My name is Pedro Pranali Valentin with student number 086. So, as we know before, Addison disease is known as primary adrenal insufficiency. Therefore, first of all, we need to distinguish it from secondary and tertiary adrenal insufficiency, as all the three of them present with almost similar symptoms. Serum HCTH level can help differentiate Addison disease from secondary and tertiary adrenal insufficiency. Skin pigmentation also appear on Addison disease, while secondary and tertiary adrenal insufficiency not. The next common differential diagnosis is sepsis, because many features of it overlap with Addison disease, such as fatigue, weakness, hypotension, and vomiting. Chronic persisting or relapsing fatigue may mimic Addison disease. However, laboratory assessment like cortical level distinguish it from Addison disease. There are also anorexia nervosa, a psychiatric condition that described as eating disorder with an obsessive fear of gaining weight. It can with symptoms like Addison disease, including hypotension, weight loss, muscle weakness, and hypoglycemia, but with elevated cortical level. The other disease is infectious mononucleosis that presenting similar to fatigue, fever, and myalgia. Another adrenal insufficiency, namely hypothyroidism, also presenting fatigue like Addison disease, but associated with gaining weight instead of weight loss in Addison disease. Thank you.
Good afternoon, doctor. My name is Vanessa Els, number 121. Addison disease treatment is divided into an acute phase and maintenance phase. In the acute phase, fluid resuscitation with intravenous normal saline, dextrose to treat hypoglycemic, and glucocorticoid and mineralocorticoid to correct hormone deficiency should be done. The most common glucocorticoid replacement therapy is 15 until 20 mg of hydrocortisone or 25 until 37.5 mg of cortisone acetate 2 until 3 times daily that can result in increased cortisol concentration upon steroid injection. Another glucocorticoid therapy are prednisolone and synthetic mineralocorticoid hormone that is commonly used is 50 until 200 microgram of 9-alpha fluorocortisone. For maintenance phase therapy, each hormone replacement therapy doses should be adjusted based on patient's clinical response, electrolyte conditions, and plasma renin levels. Physiological glucocorticoid secretions in patients with Addison disease do not respond well to fever, infections, or other illnesses. Therefore, the hydrocortisone dose, which is most commonly used for treatment, should be increased. Another condition that requires an increase in hydrocortisone dose is in pregnant women, especially during her third semester.
My name is Joko Kristra Pantipamayan with student number 252. Untreated or mismanaged of Addison disease can develop into an adrenal crisis as a result of physical stress such as infection. Gastrointestinal infection with vomiting, diarrhea, fever, and other infectious disease considered as the most important precipitating factors that add into adrenal crisis. Adrenal crisis is a life-threatening situation that can result in hypotension, hypoglycemia, high blood levels of potassium, acute cardiovascular decompensation, shock, and death. Addison disease also may develop into premature ovarian failure or primary ovarian insufficiency in 10% of women with Addison disease. Undiagnosed Addison disease can cause negative consequences in maternal and fetal development, such as decreased fetal growth retardation, suboptimal birth weight, maternal death, and intrauterine death. Addison disease may cause growth suppression in children. And in extramedullary conditions, patients with Addison disease can be complicated with dilated cardiomyopathy. Okay, thank you. Next.
Hello, my name is Anagung Putrisnania, number 195, so I will explain about Addison disease prevention. As we know, Addison disease can develop if our immune system attack our adrenal glands and severely damage the adrenal cortex. Also, it will destroy our adrenal cortex and adrenal glands will not be able to produce enough of the steroid hormone, cortisol, and aldosterone. Addison disease cannot be prevented, but we can prevent before it becomes Addisonian crisis or medical emergencies caused by untreated Addison disease by taking prescribed medication every day and increasing dosage during time of stress or illness. Thank you.
Approach to the number 237. So patients with Addison disease have a good to excellent prognosis once they diagnosis made and they've been stabilized with appropriate medication and treatment which are lifelong. So however, a Norwegian study found out that Addison disease still potentially lethal condition with excess mortality in acute adrenal failure and then infection and sudden death in patients with diagnosed at young age.
Good afternoon, doctor. My name is Adligita Pramesti, student number 044. Now I'm going to conclude our topic about Addison disease. So Addison disease is a disease that caused by inability of adrenal cortex to produce adequate adrenocortical hormones. The patient may have symptoms including fatigue, nausea, weight loss, vomiting, skin and mucosal hyperpigmentation, etc. Patient may depend on daily glucocorticoid or mineralocorticoid hormone replacement therapy. And the vast majority of patients with Addison disease may have good to excellent prognosis if they have been stabilized with appropriate medication and treatment lifelong. Okay, thank you for your attention. We're from SGD 6. Have a nice day.